Imagine a magnificent horse, full of life one day and the next, subtly, then maybe rapidly, losing the ability to stand, to swallow, even to breathe.
Hmm.
It's a silent, insidious threat. And incredibly, sometimes the danger comes from something as common as, well, hey.
Yeah, exactly.
Today, we're taking a deep dive into equine botulism. Our mission here is to give you a true shortcut to being well-informed on this critical equine health issue. We want to unpack exactly what botulism is, how horses acquire it, the signs you need to look for, and, maybe most importantly, the proactive steps you can take to prevent it.
That's right. And while the effects of botulism can be, frankly, devastating for horses and their owners, truly understanding the mechanics of this disease, from the microscopic toxin right up to the bigger picture of farm management, that's what empowers owners and caregivers.
Right. Knowledge is power here.
Absolutely.
Yeah.
We're talking about a neurotoxin so potent, its presence can turn everyday feed into a life-threatening danger. It's a hidden enemy, but an enemy we can absolutely learn to fight.
Okay, let's unpack this then. What exactly is equine botulism? Give us the essentials.
Okay, so at its core, equine botulism is a progressive, symmetrical muscular weakness in horses. It leads to what we call flaccid paralysis, essentially. The muscles go limp, they're unable to contract.
Flaccid, so not stiff like tetanus.
Exactly the opposite. Tetanus is spastic, rigid. Botulism is limp. And a classic sign is difficulty swallowing, which we call dysphagia.
Okay.
The root cause is a highly potent neurotoxin produced by a specific bacterium called Clostridium botulinum. And here's what's fascinating, or maybe terrifying. Once this toxin gets into a horse's system, it targets the connections between nerves and muscles.
The neuromuscular junction.
Precisely. Imagine your nerves are like electrical wires carrying messages to your muscles telling them to move. This toxin essentially gums up the switches at the end of those wires. It blocks the release of a chemical messenger, acetylcholine. So even though the brain might be sending the command move, the muscle never gets the message to contract.
Wow, so the signal just stops.
It stops right there. And that leads directly to that limp paralysis we discussed.
That microscopic battle you just described, it makes me wonder about the speed of this disease. You hear stories.
Yeah, the onset can vary dramatically.
Right. With a massive dose of this toxin, I read a horse might be down and, well, gone within just 8 hours.
It can be that fast, unfortunately.
But then, with smaller doses, the signs might not even show up for 10 days or even more after they actually ingest it.
That's correct. That variability is a critical point.
It makes early detection incredibly challenging, doesn't it? Like a race against an invisible clock.
Absolutely. That variability is precisely why it's such a diagnostic challenge.
Yeah.
And what's really an aha moment here for many people is that the Clostridium botulinum spores themselves, they're actually ubiquitous.
Ubiquitous, meaning everywhere.
Everywhere. In the environment, in soil, usually completely harmless. The key insight is that simply ingesting these spores rarely causes botulism in adult horses. They only produce that dangerous toxin when they find a very specific and thankfully rare environment. It needs to be anaerobic, meaning no oxygen.
Okay.
It needs a relatively high pH, above 4.5, and the right nutrients to grow.
So the spores aren't the direct threat to adults usually. It's the toxin they might produce under very specific conditions.
Exactly. It's the elaboration of the toxin that's the danger.
Okay, so if these spores are so common, how do horses actually get the toxin into their system? What are the common pathways?
Right. Well, there are 3 recognized ways horses can acquire botulism. By far the most common in adult horses is what we call forage poisoning.
Forage poisoning. So from their feed.
Yes, specifically from ingesting the preformed toxin.
Yeah.
This means the toxin has already been produced outside the horse's body in the feed, and the horse just eats it.
And where would it typically form?
Common sources include improperly ensiled haylage or silage. If the fermentation process doesn't work right, if it doesn't get acidic enough.
Below that pH 4.5 level.
Right. If it stays above 4.5, C. botulinum can thrive and produce toxin. Large, round bales, especially those baled with too much moisture, are another big culprit.
Ah, the dreaded wet round bales.
Exactly. And this one is quite striking. Hay that's been contaminated by a decaying animal carcass.
You mean like a mouse or a bird got balled up in the hay?
Precisely. A rodent, bird, even a cat. Anything swept in during harvest. That decomposing body creates that perfect anaerobic, high-protein environment for the bacteria to produce heaps of toxin right there in the bale.
Ugh, that's a disturbing thought.
It is, but it's a critical source to be aware of. Spoiled grain or contaminated water sources can also occasionally be a factor. And interestingly, the types of toxin involved tend to vary regionally. Type B is most common in the eastern and mid-Atlantic U.S.
Mm.
Type A tends to show up more in the western U.S. places like Idaho, Utah, California. And type C is often the one associated with those decaying carcasses, seen in areas like Arizona, New Mexico, Florida, and California.
Good to know. So that's forage poisoning, the most common for adults. What are the other ways?
The second form is toxico-infectious botulism. This is often called shaker foal syndrome
Shaker foal, why that name?
because the foals often exhibit muscle tremors, making them look like they're shaking. As the name suggests, this primarily affects foals, typically between, say, 6 days and 8 months of age, with a real peak between 2 to 5 weeks old.
So very young foals.
Very young. And in these cases, the foals ingest the Clostridium botulinum spores directly, maybe from the soil or contaminated feed. But unlike adults, their immature gastrointestinal tract, their gut, actually allows those spores to germinate inside them and produce toxin right there in the intestine.
So the toxin is made inside the foal.
Correct. That's the key difference.
Yeah.
And this form is almost exclusively type B.
Okay, so adults eat the preformed toxin. Foals can make it internally from spores. What's the third way?
The third, and thankfully the rarest form, is wound botulism.
From injury.
Yes. This happens when Clostridium botulinum spores contaminate a wound that provides that crucial anaerobic environment. Think deep puncture wounds.
Like stepping on a nail.
Exactly. Or surgical sites, castration incisions, even deep intramuscular injections if not done cleanly, or umbilical infections in newborn foals. The bacteria basically set up shop in the wound, multiply, produce toxin, and that toxin gets absorbed into the bloodstream. This form can be caused by type A, B, or C.
Okay, 3 distinct routes. Forage, toxico-infectious in foals, and wound. It really highlights different risk factors.
It does. Understanding the how is key to prevention later.
Absolutely. Which brings us to a really important question. What does botulism actually look like in a horse? With such a variable onset and this hidden toxin, what are the earliest clues an owner might see?
That's critical because the signs are progressive. Catching it early makes a huge difference. So initial subtle signs might just be generalized muscle weakness. The horse seems lethargic, maybe has decreased exercise tolerance, or perhaps is just reluctant to eat their hay or grain like normal.
Things an owner might notice but could easily dismiss at first.
Exactly. An astute owner, someone who really knows their horse's normal behavior, might pick up on these. As the disease progresses, you'll see more classic neuromuscular weakness. Things like trembling of the larger muscle groups. Watch the triceps, the shoulder area, and the gluteals, the hindquarters.
Okay.
They might start dragging their toes and decrease tail tone. The tail just hangs limply. Weak eyelid tone, called abutosis, where the eyelids droop. And a weak, flaccid tongue is very characteristic.
The tongue just sort of hangs out.
It can, yes. It loses its tone. But the real hallmark sign, the one vets really look for, is dysphagia, difficulty swallowing.
Dysphagia. How does that manifest?
You might observe really slow chewing, maybe drooling because they can't swallow saliva properly, or even feed material coming out of the nostrils in adult horses.
Feed out the nose. That's a bad sign.
It is. For foals with shaker foal syndrome, you'll often see milk drooling from their mouths as they try to nurse but can't swallow effectively. There's actually a simple grain test vets sometimes use as an aid. A normal horse should be able to eat about 225 milliliters, roughly 8 ounces, of grain within 2 minutes.
In a horse with botulism.
Will struggle significantly. They'll be very slow, maybe drop a lot of grain. And a major complication of this dysphagia, unfortunately, is that it predisposes horses to aspiration pneumonia.
Breathing in food or saliva because they can't swallow.
Precisely. A very serious secondary problem. As the weakness gets worse, horses start lying down more often. They struggle to get up. Eventually, they become unable to rise.
Recumbent.
Yes. First, usually in sternal recumbency, lying on their chest, upright. Then later, as they weaken further, lateral recumbency, fully on their side. Being unable to rise is a grave prognostic indicator.
That sounds dire.
It is. And ultimately, the most critical symptom, the one that often leads to death, is respiratory paralysis. The diaphragm and the intercostal muscles, the muscles between the ribs used for breathing, they become paralyzed.
I just can't breathe anymore.
They can't.
Now, you mentioned something really important for diagnosis earlier, their mental state.
Yes, a key differentiator for botulism. It's incredibly important. Affected horses are typically alert and aware. Despite their severe physical weakness, their mind is clear.
So they know what's happening, but they just can't move.
Exactly, which is heartbreaking but diagnostically useful. It helps veterinarians differentiate botulism from other neurological diseases like West Nile virus or Eastern and Western equine encephalitis. The encephalitides where altered mentation, confusion, or depression is a common sign.
That's a crucial distinction. Are there other subtle signs in other body systems?
There can be. The GI tract can be affected, leading to signs of colic or ileus, where the gut essentially becomes paralyzed. Ophthalmically, you might see moderately dilated pupils, but interestingly, the pupillary light reflex usually remains intact. And regarding urination standing, horses can usually void their bladder normally, which helps differentiate it from certain herpes virus infections where bladder paralysis is common. But down horses, recumbent horses, will retain urine and need periodic catheterization.
Okay, that's a very comprehensive picture. But it also sounds like diagnosis could be incredibly challenging, especially with those subtle early signs and the need to rule out so many other serious conditions.
You're absolutely right. Diagnosis is often presumptive, especially initially.
Presumptive meaning based on the best guess from the evidence.
Exactly. Based largely on those clinical signs we just discussed. The horse's history. Was there potential exposure to high-risk feed like round bales or silage? Any decaying carcasses found nearby? And critically, ruling out other neurological conditions.
What are some of those main rule-outs?
Well, the list is long. Key ones include equine herpes, myeloencephalopathy, or EHM, West Nile virus, equine protozoal, myeloencephalitis, EPM, and in foals, white muscle disease, which is a selenium deficiency. And as we mentioned, it's vital to differentiate it from tetanus. Both affect neuromuscular function, but remember, tetanus causes spastic or rigid paralysis, the complete opposite of botulism's flaccid or limp paralysis.
Right, opposite types of paralysis. What about lab tests? Can't you just test for the toxin?
You can, but it's not always straightforward. The gold standard test has traditionally been the mouse bioassay. You take samples, like the horse's serum or maybe suspect feed, and inject it into mice to see if they develop signs of botulism.
Okay.
But it has significant limitations. First, it's slow. It can often take 2 to 4 weeks to get results back.
Weeks, when the horse could die in hours.
Exactly. Time is critical. Second, it could produce false negatives. Horses are far more sensitive to the botulinum toxin than mice are. So a level of toxin that's devastating to a horse might not even cause symptoms in the test mice.
So the test could come back negative even if the horse has botulism.
Correct. It's not perfectly sensitive. A more rapid and cost-effective option now is the PCR test.
PCR, like for COVID.
Sort of, yeah. It detects the Clostridium botulinum DNA in samples like feces or feed or womb swabs. It's much faster.
But does finding the DNA mean the toxin is there?
Ah, that's the crucial nuance. PCR detects the bacteria's genetic material, indicating the presence of the bacteria. It doesn't necessarily confirm the presence of the toxin itself, which is what actually causes the disease.
Okay. So if the gold standard isn't perfect, and lab tests can be slow or indirect, what does this mean for a horse showing these signs? Is a vet just waiting weeks for confirmation while the horse gets worse?
Absolutely not. And this is probably the single most critical message regarding treatment. Antitoxin therapy should not be delayed in suspected cases even while you're waiting for definitive lab confirmation, if you even pursue it.
Treat first, ask questions later.
In a manner of speaking, yes, because time is truly of the essence. Every moment the toxin is circulating unbound, it's binding to more nerve endings and worsening the paralysis. And another thing that complicates diagnosis, especially post-mortem, is that there are no gross or histologic lesions. You can't just do a necropsy, look at the tissues under a microscope, and see the damage. The damage is functional at the cellular level, not structural.
Wow. Okay, so if a horse is diagnosed or even just strongly suspected, what is the treatment plan? This sounds like a true battle against the clock.
It absolutely is a battle, and it requires aggressive, immediate intervention. There are really two critical pillars of treatment.
Okay, what's the first?
First, and most importantly, is the botulinum antitoxin. This is the only specific treatment available.
Antitoxin, how does that work?
It contains antibodies that specifically target the botulinum toxin. These antibodies bind to and neutralize any unbound toxin that's still circulating in the horse's bloodstream.
So it mops up the free toxin.
Exactly. It stops the progression of paralysis by preventing more toxin from binding to those nerve endings. But, and this is crucial, it does not reverse paralysis caused by toxin that is already bound to the nerve endings.
So it stops things from getting worse, but doesn't fix the existing damage.
Correct. Its purpose is to halt further binding. This then allows the horse's body the chance to start healing and improve over time by actually growing new motor end plates, new connections.
Fascinating. How is it given?
It's administered intravenously, usually as a single dose, although sometimes repeat doses are considered. And unfortunately, it is very expensive.
I can imagine. Okay, so antitoxin is pillar one. What's pillar two?
Pillar two is intensive supportive nursing care. And the importance of this cannot be overstated.
More than just keeping them comfortable.
Oh, much more. It requires an immense amount of dedicated, often round-the-clock care, which is why inpatient hospitalization at a clinic or hospital is highly recommended, if not essential.
What does that involve specifically?
Well, first, strict confinement to prevent injury from weakness or stumbling. Then, nutritional support for that dysphagia we talked about. This often means feeding soft mashes or soups made from pelleted feed, or even placing a nasogastric tube for feeding blenderized complete feeds directly into the stomach. For foals, it might mean feeding mare's milk replacer through a tube every couple of hours.
Wow, that's intensive.
It is. Recumbent horses, those unable to stand, might even need IV fluids and parenteral nutrition. That's nutrition given intravenously. And for those recumbent horses, the nursing is particularly intense. They need deep, soft bedding to prevent pressure sores. They need to be turned or repositioned frequently, ideally every 2 to 4 hours, or at least 4 times a day, to maintain circulation and prevent lung congestion and sores.
Every 2 to 4 hours, that's literally.
It is. Bladder catheterization is often needed, especially for male horses who find it harder to urinate when down. Eye protection with lubricants is vital because their blink reflex might be weak. Respiratory support could involve mechanical ventilation, especially for foals experiencing respiratory fatigue or failure, or at least supplemental oxygen. And preventing complications is key. Aspiration pneumonia is a huge risk, so that often involves treatment with broad-spectrum antibiotics.
Yeah.
And there's an important caveat here. Certain drugs are actually contraindicated; they should not be used. Things like aminoglycoside antibiotics, procaine penicillin, and tetracyclines can actually interfere at the neuromuscular junction themselves and potentially worsen the paralysis.
Good to know. What about things like slings to help them stand?
Slings should be used with extreme caution. While they might seem helpful, the stress of being put in a sling and hoisted can sometimes hasten death in a severely weakened horse. It has to be judged very carefully.
It really sounds like an incredible amount of work and vigilance from the vets and the caregivers.
It truly is. I've seen these cases, and the dedication required is immense. It's round-the-clock care, monitoring, adjusting. It's a testament to the commitment people have to these animals.
So with that level of intensive care, plus the antitoxin, what's the outlook? What's the prognosis for these horses?
Well, even with treatment, the prognosis is typically considered guarded to poor. Without treatment, the mortality rate is tragically high, often 75 to 100%.
Sobering.
Very. However, with prompt, aggressive antitoxin administration and that intensive supportive care we just detailed, survival rates improve significantly.
How much improvement are we talking?
For adults, survival rates can range from maybe 40% up to 70%. For foals, particularly with type B toxico-infectious botulism treated early, the rates can actually be even higher, sometimes reaching 80 or even 90%.
That's a huge difference. Is there any way to tell early on which horses might do better?
Yes, a key prognostic indicator is the ability to stand. Horses that manage to remain standing or those that regain the ability to stand relatively early in the disease course have a much, much better prognosis.
And if they stay down?
Recumbency, especially prolonged recumbency, is unfortunately a very poor sign for survival. For those that do survive and receive the antitoxin, you typically see them stabilize within about 2 to 4 days after treatment.
Okay, a few days to see if it's working.
Generally, yes. Then you see gradual improvement in their swallowing ability and overall strength over the next 5 to 10 days. Muscle strength continues to return more slowly, often over the next month or so. Full recovery, getting back to their previous function, can take weeks to months. It takes time for those new neuromuscular junctions to regenerate and become fully functional again. It's a long road, but recovery is definitely possible.
Weeks to months, that really underscores the severity. Given all this, the difficulty in diagnosis, the intensive, expensive treatment, the guarded prognosis prevention sounds absolutely critical.
Absolutely. Prevention is, without a doubt, the most effective strategy against equine botulism.
So what can we do? What are the best ways to protect horses?
Okay, there are several key areas. First, and very important in certain regions or situations, is vaccination.
There's a vaccine.
Yes, there's a type B toxoid vaccine. It's marketed as Botvax-B, and it's the only commercially available one in North America and Europe. And it is highly effective against type B botulism.
So who should get this vaccine?
We strongly recommend it for horses living in endemic areas, think the mid-Atlantic U.S., Kentucky, places where type B is common. Also, for any horses that are fed high-risk feeds like haylage, silage, or large round bales, regardless of location.
Makes sense. What about foals? Can they be vaccinated?
Yes, and there's a great strategy for them. Vaccinating pregnant mares during the last stage of gestation, usually 4 to 6 weeks before foaling, allows them to produce high levels of antibodies. These antibodies then concentrate in the colostrum, the first milk. When the foal drinks this colostrum, they get passive immunity, which provides excellent protection against shaker foal syndrome during those critical early weeks and months. Foals born to unvaccinated mares can also be vaccinated directly, starting early in life.
That's fantastic for type B. But you mentioned other types A and C. Does the vaccine help with those?
That is the crucial limitation. This vaccine only protects against type B. It offers absolutely no cross-protection against type A or type C toxin.
So vaccination is important, especially for type B, but it's not a complete shield.
Correct. Which brings us to the second major pillar of prevention: rigorous feed management.
Okay, tell us about that. Avoiding wet hay.
Definitely part of it. You need to carefully inspect all hay, but especially large round bales. Look for signs of excessive moisture, visible mold, and particularly, I know we keep saying it, but it's vital decaying animal carcasses.
Right, the baled-in mouse or bird scenario.
Exactly. Finding that means the bale is high risk. Also, try to avoid feeding hay that got heavily rained on during the curing process before baling. If you are feeding large round bales, it's best practice to consume them quickly, once opened, ideally within about a week, especially in warmer, humid weather. And proper storage is key. Keep them off the ground, preferably on pallets or tires, and under cover to protect them from rain and moisture.
Okay, good tips for hay. What about silage?
Never feed haylage or silage if the pH is above 4.5 or if it looks or smells spoiled in any way. Just don't risk it. And generally, avoid feeding any visibly spoiled feed. Implementing strict rodent and wildlife control around feed storage areas is also really important to minimize the chance of carcasses ending up in the feed. And if you do find any dead animals in pastures or near feed storage, remove them promptly and bury them deeply.
Makes sense. Diligence with feed is key. Anything else?
Yes, beyond feed, think about pasture management. Regularly walk your pastures and check for any dead animals or large areas of decaying plant matter, especially in wet conditions. And finally, good wound care. Promptly and thoroughly clean and treat all wounds, especially those deep puncture wounds we discussed. The goal is to prevent the creation of that anaerobic environment where Clostridium botulinum could potentially proliferate if spores get in.
Clean wounds heal better and are less likely to harbor nasty bacteria.
Exactly. It's basic good husbandry, but particularly important for preventing wound botulism.
This is all incredibly valuable information. It really highlights how much vigilance is needed, whether you own horses, work with them, or just care about their well-being. It's not just about the big emergencies, but the day-to-day management.
Absolutely. Understanding these details, the risks in the feed, the subtle early signs, the importance of vaccination, where appropriate, really allows for immediate, informed action. And those proactive measures, that careful management, can truly make all the difference in a horse's life. It can turn a potentially fatal situation into, hopefully, a preventable one, or at least a fight for survival with a much better chance of success.
A powerful reminder of the impact of knowledgeable care. And finally, something for you, our listener, to mull on. Given the ubiquity of these Clostridium botulinum spores are literally everywhere in the soil, and yet the devastating impact of the toxin they can produce under specific circumstances, what does this deep dive tell us about the constant, often unseen battles waged in veterinary medicine, and perhaps how reliant we are on both vigilant, observant care at the ground level and the constantly evolving scientific knowledge that gives us tools like vaccines and antitoxins?